The use of the theory gives the nurse the freedom to develop the nurse's own style of practice. Nursing involves a mode of thinking, a style of practice, as well as the substantive and antecedent knowledge that they need to work.
The major concepts as defined in Orem's theory: human being, a person under the care of a nurse; environment, physical, chemical, biologic, and social contexts within which human beings exist; health, a state characterized by being structurally or functionally sound; and nursing, an art by which practitioners provide specialized assistance to persons with disabilities who require special needs for self-care while practicing in the medical plan of care outlined by physicians.
The first major concept of Dorothea Orem's theory is self-care. In order to maintain our health and well-being, we all participate in self-care activities that we perform on our own behalf. These activities are required to live. Dorothea Orem calls them self-care requisites. There are some self-care requisites that are requirements for every human. Examples of these universal self-care requisites are the need to intake air, water, food, to excrete waste, to get the appropriate balance between activity and rest, solitude and social interaction, and the need for risk assessment. Finally, there are deviation self-care requisites that occur when a person has an illness, disease, or injury. Examples of these include the need to seek medical care, to know effects of one's new condition, to care for self by following treatment recommendations, and even modify one's self-image or learning to live with the effect of one's sickness or new condition.
According to Orem's theory, self-care agency is the ability a person has to take care of him or herself. A person could have a low self-care agency or high self-care agency. An example of low self-care agency would be a preterm baby that can't breathe or swallow for him or herself. An example of a high self-care agency would be a healthy individual that can function normally. This ability, or self-care agency, is influenced by what Orem calls basic condition factors. Examples of these include age, gender, developmental state, and health state. Other basic condition factors that influence self-care agency are sociocultural orientation, healthcare system factors, family system factors, patterns of living, environmental factors, and resource adequacy and availability. When there is what Orem calls a self-care deficit, a person is either totally incapable or partially incapable of providing effective self-care. This person will then have what is called a therapeutic self-care demand. This means that for some duration of time, the person will need self-care actions to be performed or taught to him or her. This is when the nursing system gets activated.
What? Let us break it down for you.
Now, this is a story all about how Dorothea Orem got her theory written down, and I'd like to take a minute, just sit right there. We'll tell you all about how she wrote the theory of self-care. In Baltimore, Maryland, born and raised, in the hospital is where she spent most of her days. A staff nurse, a private nurse, a nurse educator, a nurse consultant, and a nurse administrator. She studied really hard. She came out on top. When she started theorizing, she just couldn't stop. She wanted to help everyone. She saw it as her mission. If you see a deficit, you'll want to catch her vision. This girl, she had it going on. She knew her stuff. Do you think that you can learn it? It's not that tough. It makes a lot of sense. It will help you with your care. You can use this theory just about everywhere. I said you can use this theory just about everywhere. Across all settings, for each and every age. You and your patient can be on the same page. If you find a self-care deficit, you've got a demand. Activate the nursing system. Let's take a stand.
A wholly compensatory nursing system is a nursing system in which the patient's self-care agency is so limited that she or he depends on others for well-being.
This patient is in a coma. Her self-care agency is so limited that she is completely dependent on others for her well-being. She has no active role in the performance of her self-care activities. She requires total nursing care to fulfill all her self-care needs.
A partial compensatory nursing system is a nursing system in which a patient can meet some health requisites but needs a nurse's help to meet others.
Hi, my name is Alice Folkwer, and I've been on both hemodialysis and peritoneal dialysis. When on hemodialysis, I was having to be dialyzed for 3 hours, 3 times a week, because my kidney stopped working. I was able to prepare my own meals and to maintain my personal hygiene. It was my job to keep track of my water intake and to follow a strict dietary plan to maintain good health. The nurse was responsible to make sure she made the proper calculations for the hemodialysis treatments in order to clean my blood and pull off the excess water within 3 hours of my dialysis treatment. The nurse would take my vitals, make sure that I had adequate water and didn't become dehydrated on the dialysis machine. My job was to let the nurse know if I was having any kind of symptoms of dehydration. Hemodialysis treatments are a patient-nurse partnership to ensure proper and adequate care.
The supportive educative system is a system in which a patient can meet self-care requisites but needs help in decision-making, behavior control, or knowledge acquisition.
Hi Michaela, how are you doing today?
Good.
Good. So I know Dr. McCumber has recently given you your diagnosis of Wilson's disease and he's told you a little bit about it. Do you remember anything that he told you?
Yeah, I think so. He said it was a genetic disorder and my body doesn't remove the copper.
Yeah, that's right. So today I'm here to educate you a little bit about what you need to do to maintain this disease and to maintain proper health, because this is a genetic disease, so you will have it for the rest of your life. So it's really important that we make sure that we can get you on the right plan so we can take care of your health. Okay? So first I'm going to start with with your diet. So here I have a list of all the copper content, the amount of copper that is in all of the food that we eat, because it is in all food and water, so you can't really avoid it, but we can minimize it. So basically it's broken down into categories. So here are the high copper content foods, here are the medium copper content foods, and here are the low copper content foods. So it is ideal to eat the foods that are on the low to medium copper content, and then with the high copper content foods, we would like you just to have those in moderation, so that we're not building back those copper levels. And then now we're going to move on to your medication. So your medication is called Cyprine, and Dr. McCumber has prescribed it for you to take 2 pills 3 times a day. You will need to take it fasting on an empty stomach, and so basically once you eat a meal, you'll need to wait 3 hours before you can take it, and then you can take the pill, and then you need to wait 1 more hour before you eat anything. So it's a total of 4 hours fasting, and you'll need to do this with each pill 3 times a day. So 3 times a day. Anyway, so do you have any questions?
No, I don't think I do.
Okay, so here's a list of all your information, and it has your medication on here and then your diet restrictions. So remember, Cyprine 3 times a day, fasting for 4 hours, and then a low copper diet basically. So if you have any questions, you can always feel free to call us, and we can leave a message for Dr. McCumber. If you have any more questions, we can have him come and talk to you again too.
Okay. Thank you.
Health is individual, unique for everyone. Gain the knowledge to be fit. Keep it up, you're never done. We're training to be nurses. We're all going places. With Dorothea's guidance, we'll cover all our bases.